Are you over 60? Then here's something you must know. Many common medicines that seem harmless could actually strain your heart or quietly damage your health. In this video, you'll discover 7 medicines seniors should be extra careful with. Some of them might already be sitting in your medicine cabinet right now. Before we begin, remember, I'm not a doctor. This video is for awareness only. Always talk to your physician or pharmacist before starting, stopping, or changing any medication. Your heart, your kidneys, and your overall health depend on it. As we age, our bodies change in ways that make medicines act differently. The liver and kidneys, which process and remove most drugs, begin to slow down. This means the dose that was safe at 40 could become risky at 70. Many older adults also take several prescriptions at the same time. Doctors call this polypharmacy. When too many drugs mix together, they can interact in harmful ways, increasing the risk of dizziness, confusion, bleeding, or heart problems. Our bodies also become more sensitive to certain chemicals. What once caused only mild side effects might now lead to serious complications like low blood pressure, irregular heartbeat, or kidney strain. That's why understanding which medicines to avoid, and why, can make all the difference for your heart health after 60. Medicine number 1, NSAIDs, Ibuprofen, Naproxen, etc. They're the pills many of us reach for without a second thought. Ibuprofen, Naproxen, and other pain relievers known as NSAIDs. They're great for headaches, arthritis, or muscle pain. But for people over 60, these everyday helpers can quietly harm the heart and kidneys. According to AARP and other health sources, long-term or frequent use of NSAIDs increases blood pressure and makes the heart work harder. These drugs also reduce blood flow to the kidneys, leading to possible kidney damage. Seniors taking blood thinners or with heart disease are especially at risk. Even an extra pill can tip the balance. What's worse, NSAIDs can thin your blood, raising the risk of internal bleeding. The pain may go away for a while, but the damage builds silently. Always ask your doctor if there's a safer way to manage pain instead of relying on these common tablets. Medicine number 2, aspirin, low dose for prevention. For years, low-dose aspirin was seen as a heart protector. Many older adults still take it daily, believing it prevents heart attacks and strokes. But newer research, including reports from AARP and Time, reveals a different story. If you've never had a heart attack or stroke, that daily aspirin might do more harm than good. As we age, our stomach lining becomes more fragile and blood vessels more delicate. Aspirin can irritate the stomach and thin the blood, leading to dangerous bleeding in the stomach or brain. Doctors now warn that the small benefit of aspirin for prevention doesn't outweigh the bleeding risk for healthy seniors. If your doctor once prescribed it years ago, don't stop suddenly, but ask whether you still need it. Sometimes, the advice that worked in the past needs an update when your body and heart grow older. Medicine number 3, Diphenhydramine Anticholinergics. You might know this one by its popular brand name, Benadryl, but it's found in cold, allergy, and sleep medicines. It promises quick relief and a good night's rest. But inside the aging brain, it can cause real trouble. Health experts from the National Council on Aging and GoodRx warn that drugs like diphenhydramine belong to a group called anticholinergics. These block certain brain signals, which can lead to confusion, blurred vision, constipation, or memory loss. In older adults, long-term use has even been linked to a higher risk of dementia. Many seniors don't realize how many over-the-counter pills contain this ingredient, from sleep aids to cold formulas. If you often wake up groggy, dizzy, or forgetful, your night pill might be part of the problem. Ask your doctor for safer allergy or sleep alternatives that protect your memory and mental clarity. Medicine number 4, Decongestants, pseudoephedrine. phenylephrine, that stuffy nose or cold can feel unbearable, and decongestant pills or sprays promise fast relief. But for seniors, they can be dangerous. According to AARP and the National Council on Aging, decongestants like pseudoephedrine and phenylephrine narrow blood vessels to clear nasal passages. The problem? They also tighten blood vessels throughout the body, which can sharply raise blood pressure and strain the heart. If you already have high blood pressure, heart disease, or take heart medications, these cold remedies can make things worse without you even realizing it. Some people report pounding heartbeats or dizziness after taking them. What feels like just cold medicine could quietly trigger heart rhythm problems or strokes in older adults. Next time you're sick, check the label carefully, and choose heart-safe options approved by your doctor or pharmacist. Medicine number 5, antipsychotics, sedatives, benzodiazepines. Feeling anxious or having trouble sleeping is common with age, but reaching for strong sedatives like Valium, Ativan, or sleep pills can come with a cost. Studies from the National Council on Aging and medical journals like PMC show that these medications can slow the brain, weaken balance, and increase the risk of falls, strokes, and even memory decline. Some are prescribed for behavioral symptoms or anxiety, but in seniors, they can trigger confusion, excessive drowsiness, and heart rhythm changes. Many families mistake this as normal aging, when it's actually the effect of these drugs. Doctors now urge careful review of long-term sedative or antipsychotic use in older adults. If you depend on sleep aids or anxiety pills, ask your doctor about tapering safely or exploring natural ways, gentle exercise, breathing therapy, or melatonin that protect both your mind and your heart. Medicine number 6, drugs that raise potassium, ACE inhibitors plus potassium-sparing diuretics. Many seniors take blood pressure or heart medicines like lisinopril, losartan, or spironolactone. They're effective, but when used together or in high doses, they can quietly raise potassium levels in the blood. This condition, called hyperkalemia, is more dangerous than it sounds. According to Best Life and other medical sources, too much potassium can interfere with your heart's electrical rhythm. It may cause irregular heartbeats, muscle weakness, or even sudden cardiac arrest. The scariest part? There are often no early symptoms until the heart is already in trouble. Older adults, especially those with kidney problems, are at highest risk because their bodies can't clear excess potassium easily. If you take these medicines, ask your doctor to check your potassium levels regularly. Sometimes, a simple blood test can prevent a deadly heart rhythm. Never adjust the dose yourself. Always get professional guidance. Medicine number 7, Rosiglitazone, and some older diabetes drugs. Managing blood sugar is crucial, but not all diabetes drugs are created equal, especially for older adults. Rosiglitazone, once popular for type 2 diabetes, was later found to increase the risk of heart failure in some patients. According to medical reports and Wikipedia data, this drug can cause fluid retention, which strains the heart and lungs. In seniors with weakened hearts, this can lead to swelling, shortness of breath, or even hospitalization. Some other older diabetes medications carry similar risks. While newer drugs are safer, many seniors still take the older ones out of habit or cost concerns. The truth is simple but serious: a pill meant to control sugar can quietly harm your heart. If you're using any older diabetes drug, review it with your doctor. Ask whether a safer alternative might protect both your heart and your blood sugar at the same time. Sometimes, it's not a single drug that causes harm, it's the combination. For example, taking warfarin, a blood thinner, along with NSAIDs like Ibuprofen can drastically increase the risk of internal bleeding. Best Life and the USC Schaefer Center both warn that certain drug mixes can double or even triple the chance of a heart attack or stroke in older adults. Many seniors unknowingly mix over-the-counter painkillers, sleep aids, and prescription heart drugs, thinking they're safe. But the result can be unpredictable: bleeding, dizziness, or sudden blood pressure drops. Even supplements like potassium or herbal remedies can react badly with heart medications. Always keep an updated list of every pill you take and share it with your doctor or pharmacist. It's not about taking fewer medicines, it's about taking the right ones, safely, together. Protecting your heart after 60 doesn't mean avoiding medicine, it means managing it wisely. First, review all your prescriptions and supplements with your doctor or pharmacist. Ask simple questions like, do I still need this? Or, is there a safer option? Use the lowest effective dose and avoid taking two drugs that do the same thing. Focus on lifestyle habits that naturally support your health: a balanced diet, light daily movement, good sleep, and stress control. If you ever feel dizzy, unusually tired, or short of breath after starting a new pill, report it immediately. Regular checkups and blood tests for kidney and heart function are not optional, they're your safety net. Remember, smart medicine use can add years to your life and keep your heart beating strong. Now you know the 7 medicines that could quietly harm your heart after 60. Some of them are common, some even sold without prescription, and that's what makes them so risky. Don't stop or change any medication on your own, but do start a conversation with your doctor. Ask questions, stay informed, and protect yourself from avoidable danger. If this video helped you, please give it a thumbs up, share it with a loved one, and subscribe for more senior health tips that truly matter. Your small step today could prevent a big problem tomorrow. This video is for educational purposes only and does not replace medical advice. Always consult your doctor before making any changes to your medications. Every person's health story is unique, and your doctor knows yours best. Stay informed, stay safe, and take care of your heart. Thanks for watching, and see you in the next video.